Hi everyone, I'm Dr. Rakesh V. I'm a critical care specialist and an ECMO physician from Hyderabad. So I have got an extensive experience in ICUs, especially when it comes to infection control, hemodynamic monitoring, and extracorporeal supports. Today, I'm going to discuss about an important topic in your ICUs, which is generally neglected, but it's the most important thing in any other ICU, which is nothing but infection control, how it is going to affect your patient outcomes, and what are the infection control practices, what are the most common things which we generally miss in our infection control practice, etc. So going into the topic, so let us see first of all what is the risk of infections in the ICUs. The intensive care unit is a high risk environment for all the infections. You know what? All the patients here will have a weakened immune systems and they have invasive devices like starting from IV cannulas, they have central lines, they have arterial lines, they have ventilators. So all the pipes for all the artificial things like the Foley's and the rail tubes, etc. These always provides a pathway for the bacteria to enter into your human body. So additionally, one more important thing is the close proximity of patients inside the ICUs and then complex treatments which they generally involve for all your patients. All these things will increase the risk of infections, even the bacteria that is coming from the outside which is getting transmitted to air. So all these things will pose a lot of risk of infections to your patients, particularly the ICU patients because they're more vulnerable. So this makes us to discuss about this topic about the infection control protocols and how you're going to do it and how important it is to decrease your ICU acquired infections. So let us see what is a bacterial contamination load in different surfaces which are available inside the ICU. ICUs harbor different surfaces like several inanimate surfaces will be there like bed rails, monitors, ventilators, the doors, infusion pumps. So all these things which you generally commonly touch will harbor dangerous pathogens. The most common bacteria which are found include MRSAs, methicillin-resistant Staph aureus, Pseudomonas aeruginosa, and most dangerous is Acinetobacter baumannii. So all these organisms, what they do, they survive on these surfaces for days to weeks. They pose an ongoing infection risk to all your patients. So what you have to do, your regular cleaning and thorough cleaning of all the surfaces which is there and are posing risk for all your patients. So these should be regularly cleaned and they should be regularly disinfected. All the ICU equipment should be regularly checked with the swabs and checking the culture's growth and etc. So this will decrease the chances of your infections getting transmitted to your patients inside the ICUs.